Scientists increasingly report evidence that consciousness can persist during clinical death, and studies of near-death experiences and organized brain activity during cardiac arrest suggest death may not be the absolute end, a possibility with profound and unsettling consequences. The debate has shifted from anecdote to data, as researchers collect thousands of consistent near-death reports and measure brain activity in dying patients. Thousands of near-death experiences, NDEs, show recurring elements, out-of-body awareness, tunnels of light, meetings with deceased loved ones, that many scientists now treat as genuine phenomena rather than mere hallucinations. These accounts have pushed some clinicians and neuroscientists to ask whether subjective awareness can outlast the body's conventional signs of life, and to design studies that test awareness during periods when the heart and brain show little or no activity. One of the most rigorous efforts, the AWARE program and related investigations, tracked cardiac arrest survivors and documented cases of verifiable awareness during clinical death. In some studies, roughly 40% of survivors reported some form of awareness, and a small number described accurate perceptions of events that occurred while they were clinically dead. Parallel work has recorded organized neural patterns in the moments around cardiac arrest, suggesting the brain's final seconds are not a simple, instantaneous shutdown, but a complex transition that may support conscious experience. Researchers such as Sam Parnia have popularized these findings and argued they demand a rethinking of how consciousness and death interact. If consciousness can persist beyond conventional death markers, the implications are wide and often disturbing. Ethically, medicine would face new obligations about end-of-life care, resuscitation windows, and informed consent. Legally, definitions of death used in organ donation and criminal law could be challenged. Religions and philosophies would confront empirical data that either supports or complicates long-held beliefs about an afterlife, while families and societies would wrestle with the emotional fallout of a world where death is less final than once thought. These are not abstract problems. Policy, hospital protocols, and personal grief practices would all need reassessment. The most terrifying consequences are psychological and social. A reality in which consciousness can persist raises questions about identity, control, and privacy. Who owns memories that outlive the body, and could experiences after clinical death be observed, recorded, or exploited? The prospect of lingering awareness also reframes suffering and mortality. Dying might not be a single, private event, but a process with moral and political stakes. For many, the comfort